武汉整个就像一座空城，然后没有太阳的时候就觉得阴沉沉的，看上去好悲怆。
2020年1月23号10点起，全市城市公交、地铁、轮渡、长途客运暂停运营。
我们就很明显地感到，这次不一般，
生命太脆弱。
利息好了没有？利息给我，利息给我。
几十万的标本要采集，
你活不来了，活不来了。
全国各地累计已派出251支国家医疗队支援武汉抗击新冠肺炎疫情。
我不想。
那么我们每天可以达到200吨熔喷废制造材料。
太难了，再要拖下去，我老爹就没命了。
At the end of December 2019, an unidentified pneumonia emerged in Wuhan. A large number of residents developed symptoms such as fevers and coughing.
进病房的时候，第一眼映入眼帘，就是护理站排了好长的队，都在那等待住院。晚上10点，然后有的都是喘得非常厉害的，大家都非常惶恐。
Jinyintan Hospital is among the first batch of hospitals for treating confirmed COVID-19 cases, and also the hospital receiving the most of these patients. The first patients were transferred to Jinyintan around December 29th. At that time, doctors here, who had a lot of experience dealing with various infectious diseases, such as viral pneumonia and flu, felt something was different.
做了 CT 和肺部影像学，
肺部什么样的？
它是毛玻璃一样的那种改变，是病毒性肺炎的典型症状。因为我们有 SARS 的经验和那个 MERS 的救治经验的话，我们就很明显的感到这次不一般。就是平时没有发生疫情的时候，每年也有很多病毒性肺炎。
On December 30th, Jinyintan Hospital collected lower respiratory tract samples from 7 patients. They were then sent to the Wuhan Institute of Virology of the Chinese Academy of Sciences for testing. The next day, December 31st, the WHO China country office was informed of the cases. On January 6th, the Wuhan Institute of Virology isolated a novel coronavirus from the lower respiratory tract samples taken at Jinyintan Hospital. The pneumonia of unknown origin was clarified.
因为它的现在已经存在有人传染，同时医务人也有传染。
做这个决定，这个国家也是非常慎重的。现在全国20几个省都有输入性的病人，所以必须采取严格的措施。
加油，武汉！加油，中国！
January 24th is Chinese New Year's Eve, the most important holiday of the year for Chinese people. On that day, 128 members of the Guangdong Province Medical Support Team rushed to Wuhan.
这就像我们去赶一场大考，出题的不是我们，但是我们去答题。
全国各族人民都同你们站在一起。
After that, 52 medical teams from 29 provinces and autonomous regions arrived to support Wuhan. On Chinese New Year's Eve, the People's Liberation Army also sent 3 medical teams, totaling 450 people by military aircraft from Shanghai, Chongqing, and Xi'an to assist Wuhan. At the same time, with the influx of more and more patients, Wuhan's local hospitals began to vacate their general wards to admit greater numbers of COVID-19 patients. With the number of infections growing, the entire medical system in Wuhan faced the pressure of work overload.
几十万呐，几十万的标本要采集啊！
你来洗皮球，利息好了没有？利息给我，利息给我。
Zhu Haixiu was among the first batch of nurses from Guangdong Medical Team to assist Hangzhou Hospital in Wuhan.
这2天累吗？压力比较大吧。
Zhu said although the Guangdong medical team brought 267 medical workers to assist Hankou Hospital, there was still a shortage of staff. She was working in several wards.
给家里人报个平安吧。
我不想哭，我一哭的话，我的护目镜就关了，我就干不了事情了一会儿。对不起。
On January 23rd, the first day of the city's lockdown, construction of Huoshanshan Hospital started. 2 days later, the construction of Leishanshan Hospital began. More than 30,000 workers rushed to Wuhan from all over China to work around the clock to build these 2 temporary hospitals. The Ministry of Industry and Information Technology transferred 14,000 items of protective clothing and 110,000 pairs of medical gloves to Wuhan. On February 2nd, Wuhan started to admit diagnosed and suspected COVID-19 patients, as well as patients with fevers and people who had been in close contact with confirmed cases.
像这种需要在酒店隔离多久
？14天。
在14天会不会觉得有点不太习惯？
但是呢，那个你还是要配合政府搞好那个事情，是吧？因为那个太大了，对人们的危害太大了，肯定人要积极一点嘛。人都是为国家、为自己着想，为国家着想。你要是光为个人着想的话，有什么意义呢？你没有国家，你哪有自己搞什么搞嘛？
On the evening of February 3rd, Wuhan decided to expropriate the city's exhibition venues and transform them into temporary hospitals to treat patients with mild symptoms. The number of beds gradually overtook the number of patients. Chen's father has not been admitted to the hospital since he was diagnosed with COVID-19.
他说今天可以住院吗？我们等了好长时间了，我们2号就开始发烧了，
是吧？
一直到现在病情越来越重了。
今天得到这个消息是不是还挺激动的？
哎呦，我激动的哭了，真的激动的哭了，太难了，太难了。 是激动了啊！真是不能用语言来表达的。再要拖下去，我老爹就没命了。我们真是感到非常太感谢政府了。
The first 3 temporary hospitals were converted at the Wuhan International Convention and Exhibition Center, Hongshan Stadium, and a cultural complex known as the Wuhan Living Room, and provided 4,400 beds in total.
您在这儿住着感觉满意吗？
还行吧，能谈上满意，别人也不容易啊，外地来支援我们那里有这么多人，深更半夜的把它搞好了，别人工作了25个小时，那你还有什么可抱怨的？你只休息，只睡觉。
From February 6th, Wuhan started conducting a grid-by-grid search to check those who had close contact with confirmed patients, patients with a fever, people with clinical symptoms, and confirmed patients who quarantined at home. In 7,148 communities, holding nearly 10 million people, community workers knocked on every door to measure residents' temperatures. At the same time, Wuhan's lockdown became stricter. On February 11th, all compounds were closed and only one family member was allowed to go out, once every 3 days.
您今天还需要买什么东西吗？好的。
Wang Yaling is a community director in Wuchang District. She was responsible for helping residents buy daily necessities during community closures.
哎，你好，社区了，送菜了，帮你放门口了啊。好的，谢谢。对，你那边到我们早晨出来了啊。哎，好了，行。把菜也放他们那个发热病人或者是疑似人员的门口，也尽量避免和他们的直接接触。
您也看到了，我穿的是雨衣是吧？戴的是那个眼镜，然后头上包的是那个一次性的浴帽。我们可以用这些方法
来保护自己。这样子约，如果戴1天的话，它就会自己崩掉，然后耳朵已经后面像耳朵割掉了一样。然后我耳朵这还做了手术的，前不久特别疼，戴1天。
其实作为在基层工作的书记，我们不在乎什么表扬，我们只希望我们的这个城市快点好起来。
However, the strength of the community was far from enough to meet the huge needs of the city's 11 million people. Some citizens stepped up to be volunteers and helped transport medical staff to work and deliver daily necessities to residents. On February 12th, there were 13,436 newly confirmed cases in Wuhan, with the number reaching the peak. This is because the National Health Commission updated the 5th edition of the novel coronavirus pneumonia diagnosis and treatment plan on February 5th, which added clinical diagnosis to the diagnostic criteria. Nucleic acid testing is no longer the only diagnostic criterion. Joe is one of the drivers transporting patients since the coronavirus outbreak began.
我们运送的是轻重病人、密切接触者跟疑似患者。
我但不管我是阴性放阴，要是把我弄起来我立死的。
你不想去是吗？
肯定不想去的。
Today he was going to take a suspected patient, Mr. Peng, to the hospital for testing. However, it didn't go well.
肯定是有，肯定片子上有问题。
他认为自己没问题了，那怎么可能自己说了没问题就没问题了？你有用科学的手段说你没问题了就没问题了。
Accompanied by Joe, Peng had another CT scan.
我觉得这还是有一
点就是靠这个
一定要排查到每一个人，是为了你好我好整个国家。
我是一年14年，还要
再坚持3天，好吧，3天给你复查。
如果说外面还有一个像他这样的疑似病例，都是一种潜在的威胁。我们只有让他得到医生正确的确诊以后，证明他不会传染，他才能够回家。
With new confirmed cases decreasing, the main COVID-19 battlefield has shifted to the ICUs. Dr. Zhou Ning is a cardiovascular physician working at Tongji Hospital, affiliated to Huazhong University of Science and Technology. He is going to perform an ECMO operation on a critically ill patient in the ICU. Surgery begins.
陈先生，千万坚持一下，5分钟之内结束，好不好？看一看，看到了没有？你活过来了，活过来了，看到吗？小心点啊！很好，很好。来，不容易了。不容易，不容易，太不容易了，太棒了。
By February 28th, the number of severe cases in Wuhan had reached 6,775, accounting for 22% of the confirmed cases. Doctors in ICUs raced against death day and night in an effort to reduce the mortality rate.
有的生命其实有时候很脆弱，那有时候呢也是很坚韧的。对这个新冠肺炎病毒，它的认识我们也是逐步加深。我们现在艰难地迈出了第一步，我觉得未来可期，病亡率一定可以逐步降下来的，所以我们会尽全力。
At least 2 makeshift medical facilities in Wuhan have cleared their
定点医院、方舱医院、隔离点3类地点床位已经全部实现床等人。桥口五体方舱医院将会进行修舱处理。今天开始，陆续有支援湖北的医疗队将分批撤离。
Some bus and subway lines are coming back between today and Saturday.
到学校了，爸妈。到学校了，哎，一辈子上特别好。
我们更好活下去，对他们来说也是更好的一个寄托和希望吧。一起向前奋斗吧！多少医生死了，他是拿命来拼来的，所以武汉人民都得感激他吧！整个武汉人民感激他吧！
先回家。对。爸爸打完针了是吗？
不打针了。
不打针了。